Hi, hope you are doing well. In this lesson, we will discuss the medical abbreviations starting with alphabet A. So, let's begin. In this video lecture, we will discuss the following abbreviations: ACS, ACTH, ADH, ADHD, and AED. The full form of ACS is acute coronary syndrome. This abbreviation is used for a range of cardiac conditions caused by sudden reduced blood flow to the heart, for example, during heart attack or unstable angina. The next term is ACTH. The full form of ACTH is adrenocorticotropic hormone. This is a pituitary hormone that stimulates cortisol release from the adrenal gland. The adrenal glands, they are located on the top of the kidney. So adrenocorticotropic hormone is released from the pituitary gland, which in turn stimulate these suprarenal glands known as adrenal glands, which releases cortisol. The next term is ADH. The full form of ADH is antidiuretic hormone, also known as vasopressin. The antidiuretic hormone, it is synthesized by the hypothalamus, but it is released by the posterior pituitary gland. The function of the ADH is it is a hormone that reduces urine output by increasing water reabsorption in the kidneys. So, low level of antidiuretic hormone. When the level of the antidiuretic hormone is low, it results in excessive thirst and urine. While when the level of the ADH in the body it is increased, it results in fluid retention because antidiuretic hormone it reduces urine output. So when the levels are high, it results in fluid retention in the body and reduced thirst. The next term is ADHD. It is a very popular or very well-known term. So the full form is Attention Deficit Hyperactivity Disorder. So it is basically a neurodevelopmental disorder that is characterized by inattention, means not being able to keep focus. Hyperactivity, which means excessive movement or restlessness, even at inappropriate times. And the third characteristic is impulsivity, means acting without thinking or having trouble with the self-control. So these are the three characteristics: inattention, hyperactivity, and impulsivity in attention deficit hyperactivity disorder. This disorder, it is common in children, but it may persist into adulthood as well. And it is usually treated with stimulants, that is a pharmacological therapy, but with some behavioral therapy as well. Then the next term is AED. AED, the full form is Automated External Defibrillator. It is a portable device that delivers shock to restore normal heart rhythm, for example, during a ventricular fibrillation. I hope this lecture is useful. Thank you.